Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. What started as all things related to brain health and wellness has morphed into largely brain injury health and wellness, with occasional other neurological topics. My mission remains the same, to help you on the path to a healthier brain. So, without further ado, let's get into the show. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. Today, I am back with the next installment of the ABCs of concussion, covering letter P. And I can't believe we're already up to this letter of the alphabet. We've had so many episodes on the ABCs of concussion. So again, if you're just joining in now, you haven't heard all of the previous letters, why I'm doing this series is because we need more education on concussion. We need to know more about it, what it can look like. And again, concussion is a brain injury. So it's not just a one and done type of thing. It is a chronic health condition that we see issues lasting for years, lifetimes for people. And so again, why do we do this is because so many people have had a concussion and didn't realize that that's what happened or what occurred. We call it a bonk on the head. We see stars. Some people call it blacking out. I don't know how you can call it blacking out without realizing that something more happened, but some people call it that as well. And they don't think about the lasting consequences of it. Typically, as I'm seeing patients, if they have new symptoms and they didn't have them before they had their head injury or their concussion, whatever caused it, their brain injury, it's typically then thought of as this is now related to your brain injury because you didn't have it before your injury and now you do. So if you have any of these symptoms, you experience these things and you don't know why you've had them, you don't have a real good explanation, think back to when they started. Did you have something prior to that symptom start that may have constituted a brain injury? And if you've had a brain injury, you've had a concussion, and you still have some of these symptoms and you don't know why, we'll kind of explain the why as we go through these things. So it's helpful for many reasons. And if you're the provider taking care of people that have concussions and brain injuries, this helps you to understand more of what's going on in their world, what they're experiencing, what they're going through, and how we can help them better. So again, today we're into letter P. Again, little quick commercial for the only support that I have. If you like what you hear on the show, you can buy me a coffee, which doesn't really buy me a coffee. It just sends a little bit of monetary value into the show. If you like it and you want to support it, that link is in the show notes. You could buy one of my books. That would also help me as well. My Migraine Help from a Unicorn Nurse Practitioner or my Welcome Back TBI Recovery Story from Provider to Patient, both available on Amazon. And the TBI book is also on Barnes & Noble online. So either place you can get those. And the link to find all of that is in the show notes as well. So without further ado, let's get into the ABCs of concussion, letter P. So the first topic today, starting with a P, is PTSD. Most of us know this. Just about all of us have heard of this. It's post-traumatic stress disorder. And it tends to happen following some sort of traumatic event, whether it was a physical traumatic event or an emotional trauma. Either one can cause PTSD. And with TBI, I see this relating back to, or it can be related to people that experience a motor vehicle accident, intimate partner violence, or other assaults, especially if it was a repeated violent event that definitely can cause some PTSD as well. In my practice, where I see it most is individuals who work in correction facilities, in individuals who work in home care with patients who have behavioral dysfunctions, in school settings working with special education children, especially the violent ones. And then we also have the occasional random assault. And of course, there's intimate partner violence as well. I do have a handful of patients that have finally admitted to that. Typically, they don't admit to it at the time because their partner's with them for a lot of those appointments. So how do you admit that this happened during an intimate type of event when the partner who did the damage is with you at those appointments? So many times they're not reporting what actually happened until they're out of that situation and they feel safe. So lots of different reasons why we can end up with PTSD, that trauma that comes along with the brain injury. And research has clearly identified that when somebody has PTSD and a TBI, when those two things occur together, the healing for both of those things is prolonged. Healing from the brain injury takes much longer if you have PTSD than if you didn't have PTSD. And again, your PTSD will keep getting triggered when your brain isn't fully healed. So it's kind of a downward spiral on that. What can PTSD look like? Sometimes people report nightmares about the event. They get anxious and have anxiety when they're in situations that are similar to the event that caused the trauma, such as with mine. I had PTSD from my car accident. And anytime I was in the car, especially if I was going through an intersection that had the same kind of layout as the intersection we had the car accident, or even just seeing emergency vehicles drive by me on the road, that would trigger some PTSD for me while I was driving until I got treatment for it. But that anxiety is definitely there. Recurring thoughts about the trauma, even if they're not nightmares, a nervousness or stomach upset when you're talking about the traumatic event. And then if it was a work-related thing, if you got assaulted while you were at work, the thought of going back to work can cause a lot of anxiety if you have this unresolved PTSD as well. So how do we manage it? Psychotherapy is the number one. Are there medications that can potentially help? Maybe some of the benzodiazepines, the anti-anxiety medications can help a little bit, but you need to treat those triggers. So psychotherapy, and it's not just talk therapy. It's just talking through. I've had several patients who they've been working with their therapist for 20, 30 years, and they never really seem to resolve the concerns that they have because we really haven't addressed it appropriately. So there are different types of therapy. One being EMDR, stands for eye movement desensitization and reprocessing. ART, I had a guest on that talked about ART several weeks ago, Phoenix Rising Therapy. ART stands for Accelerated Resolution Therapy. It's kind of like EMDR on steroids, just works faster essentially. And brain spotting also is another type of PTSD treatment where you reprocess all of these. Use some visual techniques to reprocess the memories and the emotions attached to those memories so that you might still see the thing, it'll still be a memory, but it doesn't cause that same level of anxiety for you. And it can let you heal. I did several months of EMDR after my car accident, and I got to the point where I could drive down the road without having a panic attack. And it was amazing, and it was miraculous and wonderful. And then I also got to realize that my brain started healing because I wasn't trying to heal the mental part and the physical part at the same time. So very, very important. Yes, those medications may have a role. And then the bigger thing in society is that we need to remove the stigma from it because patients cannot get better from their TBI if the PTSD is not addressed. So it's not a luxury. It's not a maybe you should do this kind of thing when I talk to patients in clinic. It's this is what you need to do to heal from this part so that your brain can heal from your brain injury. Okay, so it's a thing. It's a real thing, and we need to address it. The next P letter I have is PT, physical therapy. So physical therapy is an old standby. We're all familiar with it. That is one of those few things that if you see your primary caregiver before you get to neurology, they might order that referral for you because they see the need and it's there and it's research driven. And for years and years and years, we've sent patients to physical therapy. So that's always been a traditional treatment for TBI. We typically have always thought of PT as kind of there for those gross motor functions, the big motor functions, such as walking, your balance, things like that. And balance and vestibular treatment is very, very important for TBI because a lot of those vestibular functions get affected by somebody with a brain injury, that the injury itself can lead to a lot of those vestibular troubles where you get vertigo, have balance issues, you close your eyes and you can't stand up straight, things like that. Oftentimes the physical therapist will do something called a Dix-Hallpike maneuver. They turn your head, have you laying back quickly, and they're trying to see if that reproduces that dizziness for you. What it's looking for is something called BPPV, benign paroxysmal positional vertigo. So when you get in these certain movements, that's what causes the dizziness. And that's related to little crystals inside your ear. There's 3 little teeny bones. One of them has several little circular canals. It looks like a little snail shell. Inside of those bones are little teeny tiny hairs that have little teeny crystals on them. And those crystals can get knocked out of place, and you now cannot sense where you are in space with your eyes closed, especially. So sometimes we can see some what we call nystagmus or beating of the eyes. Sometimes it's so slight that when somebody has light on and they can focus, we can't notice it. But physical therapy or some chiropractors can put on these goggles that takes away all the light, and all of a sudden we can see that bouncing of your eyes because it's there and we just weren't able to treat it previously because we couldn't see it to the naked eye. We needed that darkness so that the person didn't have something to focus on. And if it's not that BPPV, if we rule that out, there are other treatments that can work on the other causes of your vestibular and balance functions. So PT also works on coordination, hand-eye coordination, multitasking, the physical multitasking part of things. The thinking part of the multitasking will be occupational therapy. but proprioception. So proprioception is the fancy term for that ability to tell where we are in space. So when we have our eyes closed and we can still touch our nose, we know where that nose is, we know where to reach for things. But in somebody who has proprioceptive errors, there's a problem with that proprioception. They can close their eyes and they're touching their cheek. They have no idea where that nose is. So that also makes difficulty when you're walking because that can make your balance very much off and you end up having falls because you don't know where you're putting your feet. Lots of reasons why proprioception is important. And then physical therapy can help to retrain some of those receptors. Physical therapy can also work on like neck pain and mobility issues related to whiplash. That's another big part that we see with concussion is the whiplash, especially from those motor vehicle accidents. Sometimes the sporting events as well from the sudden stop of the movement. So things like massage, heat, dry needling, ultrasound, all of those things are things that a physical therapist can do as well. And I wasn't always aware that they could do those. So I figured it'd probably be good to highlight it because probably not all of my listeners are aware of it as well. In some settings, sometimes depending on the facility, sometimes they overlap a little bit and they also do some visual exercises with patients where that's normally with an OT type of thing, but I've had several patients come in and their PTs are working on their vision as well. And then the amount of visits will depend on your insurance coverage. We reevaluate periodically. And I will say oftentimes insurance cuts you off before you're actually done. So many times therapy tries to get you to 80% of your normal function and they give you exercises to work on at home. And they're hoping that you're doing those exercises to help continue improving because if you don't continue those exercises, it's a use it or lose it phenomenon. If you don't use the muscles that you just learned how to use again, then you might forget. So you have to keep doing those exercises. And the big thing that I like to make note of this is that it's important to find somebody who has experience with brain injury. Not all physical therapists have worked with somebody with a brain injury. If you go to a facility where they see a lot of strokes and things like that, you're going to get probably a little higher level of functioning than if you go to someplace that doesn't see a lot of that. And then there are facilities that are strictly TBI related. Here in Minnesota, we have Hennepin County Medical Center. They have a TBI program that is specific to those TBI patients, and the physical therapists, that's all they do is TBI. So they know exactly what they're doing. They're doing a phenomenal job. So sometimes if patients are working with a non-TBI specialist and they kind of get to a plateau, I encourage them to transition over to the TBI specialist at that point. So that's our physical therapy talk for the day. There's a little brief and to the point there. The next P is problem solving. So on the point of the individual that has the brain injury, problem solving becomes very difficult. Triaging, troubleshooting, problem solving, all of that it becomes very difficult work after a brain injury. So that is a frontal lobe executive function. So when we have damage to the front of the brain, and I like to give the caveat of this as well. So we have that coup contra coup injury. I've talked about that on previous episodes. The coup is the direction that your brain was going to begin with, and the contra coup is the opposite side. We can get those injury on both both sides with that injury. So it's not just a one-sided injury. So even if you're hitting the back of your head, your brain's sloshing to the back first, and then it comes and bounces to the front. So you can still get that frontal lobe damage, whether or not you hit the front of your head. So that frontal lobe executive function is where our problem solving is. So when we have, again, that damage, it makes it very difficult to triage in life and at work and all the places that we need to make decisions and troubleshoot things. This requires your ability to process the thoughts that you have and think about consequences. And the consequence part is where it becomes very difficult. So as you may or may not know, our frontal lobes aren't fully developed until we're in our mid-20s. So we roughly say around age 25, your frontal lobe begins or is finally finished developing. So up until that point, that whole consequence thought process might not be there. So when people are getting injured around that time frame and they haven't had that full development of their frontal lobe, that difficulty in triaging, troubleshooting, problem solving, risk taking, thinking about consequences can be affected down the road because of that. So when we talk about like males versus females, males tend to be at a higher risk because they take more risks, they do more risky things, and that early 20 area, that's where we see typically more males than females having head injuries because they are doing more risk taking. Girls tend to think about the consequences even more, even though our frontal lobes aren't fully developed until that point either. But we tend to do a little bit more thinking about those consequences. So it does make a difference when you have that brain injury, where you are in that development. and whether or not you might have issues moving forward, thinking about consequences and risk taking that might put you at risk for other head injuries as well. So getting back to the problem solving part now, though, I kind of got off on a little tangent there. Sorry. When we think about problem solving, again, we have to be able to analyze steps in a sequence to identify where something went wrong. That is the whole thought behind troubleshooting, triaging. Looking at those steps in the sequence and figuring out where something went wrong so that we can fix it and adjust it. This tends to be much more difficult when you're fatigued, when you're tired, when there are lots of distractions. So if somebody has damage to that part of their brain, it makes it difficult to focus on that troubleshooting piece when there are distractions. How do you manage this problem-solving issue? The big time is because you're having trouble with multiple distractions, focus on one task at a time. We all pride ourselves so much on our ability to multitask, but after a brain injury, tasking becomes difficult. Multitasking is essentially impossible. So focus on one task at a time to do it really well. I have learned that if I'm working on something and one of my kids come up, I've talked about this on the show before, my kids come up and they want to talk to me, I have to stop what I'm doing. Otherwise, I'm not focusing on what I'm doing and I'm not focusing on what they're saying. So I'm probably not going to remember what they're telling me. And most of the time, it's something pretty important that I need to remember and I need to know. So focus on one task at a time. Break down complex problems and tasks to smaller tasks. I just had this conversation with a patient not that long ago. She was talking about how to do the steps that she needed to do to get back at work. And she was trying to think about all the processes and she was really struggling and having a difficult time. So we had to talk about breaking it down to what are all the steps in that process that you need to do. Yes, you might have multiple different processes. Are there some steps that are going to be the same regardless of which vendor or whatever that you're working for in the particular role that she had? Can you write down those steps so that you can break those down and you can check them off as you do those steps? It's less likely that you will forget some of those steps than if you have them written down. Even if it's something you've done a million times, just writing down those steps. Another example would be like doing the laundry. Yes, you can say, I'm doing the laundry. But doing the laundry is not one step. Doing the laundry is putting the clothes in the washer, putting the soap in the washer, turning the water onto the right level. When that's done, you have to take the clothes and put them into the dryer. Maybe you might have a couple items that shouldn't go in the dryer, so you have to think about taking those items out and putting them someplace else, putting them on a hanging rack or whatever, drying rack, before you put everything into the dryer. You have to put the dryer sheet into the dryer, your dryer, those balls, whatever you use in the dryer, you have to put that in there as well. And then when that's done, you just take them out and fold them and put away. And there's a lot more steps. So it's not just doing the laundry. You're doing all of those steps along the way and trying to remember all of those steps. So break it down. Write it down in the different steps so that you can remember them. Try to use memory aids. Our phones. We have our phones with us like 24/7 now. And you can set reminders. You can set timers on that. If you have devices in your home, a Google device or an Amazon device, you can have that device set reminders for you. You can have it tell you things. Our family struggles getting garbage out on garbage day. So I've half thought about turning on an alarm or an alert on our device in the kitchen so that it can remind all of us that we have to get the garbage out that day so that we don't miss it, because we have missed it a couple times. See, it's not just a TBI thing. People without a TBI forget things too. I'm not the only one in the house that forgets that. Anyway, use memory aids. Some people like Post-it notes. Put a Post-it note on things that you need to see. That works too. So just something that's going to spark your memory. Minimize distractions. It's tough to think when there are distractions, so just minimize them. Work in a quieter space if you need to. Take frequent breaks. And this is one thing that my therapist, my PTOT, everybody kept telling me along the way. Take breaks before you need them, because then you're less likely to need them as badly. So take breaks frequently. Allow extra time for problem solving. If you know you're going to have to triage something and think about something, give yourself extra time to do it. Don't think that you're going to rush through it just as quickly as you did before your brain injury. Give yourself a little extra time. You will thank yourself for you later. And again, because we have our phones, there are so many games, puzzles, apps that you can pay for. Some are free to help you relearn how to do things and learn to track your memory a little bit better. So lots of memory playing apps and problem solving apps where you have to get different colors out of the screen, different arrows, lots of different games that can play your memory. Just be careful not to do it too much so you give yourself a headache. Because again, if you're spending a lot of time on screens, that can be very headache producing as well. So sometimes people play games on their computer or on a tablet if it's a bigger screen. I was just in a support group meeting recently that I gave a presentation, and one of the gals said that she started to cast her computer screen up to her TV, and then she wasn't having headaches from looking at it anymore. And that's a great idea. All these different tips and tricks to try to reduce that overwhelm, reduce the stress, reduce the work on your brain. And then, of course, cognitive issues, memory issues, problem solving, triage, troubleshooting, any of that fall under the purview of a speech language pathologist. So speech therapy, really important for helping with some of that troubleshooting, triaging type of activity. So that's it for the problem solving part of today. So the next P I want to talk about is processing. Processing the information that you take in, whether it's visual, auditory, any of those processing things can definitely be affected by a concussion because, again, those are executive functions. So many people report feeling slowed thinking, feeling foggy. That brain fog type of feeling is a very, very common report for patients that have a brain injury. So trying to figure out this whole step of processing. How do we process the information that comes in? Our brain is doing this naturally for us 99% of the time. And then when we have a brain injury, it drops down. Can't tell you to what percentage, but it drops down. So we're not automatically doing that processing anymore. And we stop and we get this little hitch in our thinking. We're trying to think of what's going on. It's kind of like when somebody asks you a question and you say what before you have the opportunity to answer, and then you process it, and then you're able to answer before they even actually repeat themselves. But you had to say what first because your brain needed that extra time to process what was being asked. So that's a very common thing to see after a brain injury. People will say what and then be able to come up with the answer. Overexertion, poor nutrition, poor sleep, all of these things will make it worse for trying to process the information that's coming at you. It also tends to worsen in busier situations. So again, a lot of distractions, a lot of things going on around you, or when you're very emotional, that also makes that processing slow down because, again, your brain is now being torn between multiple different things. What does it look like with that difficulty processing? I gave one example already, but again, having to have things repeated multiple times. So asking somebody to repeat themselves is not necessarily that you didn't hear them, but you didn't understand what they said. So asking for things to be repeated. The inability to follow multi-step processes. So when somebody asks you to do something, and my kids joke about this a little bit because we have a lot of ADHD in our house, and people that have ADHD tend to have a little bit of this anyway. And then if you have somebody that has ADHD that has a brain injury and now they have worsened ADHD, it's definitely going to be an issue. But that inability to follow multi-step processes, and then you might need to have to ask for clarification after different steps. So I did these steps, and what did you want me to do next? Because you can't remember what was next. Makes it difficult at work when you get directions from an employer or colleague, whatever, and then you forget those directions that you're supposed to do. Makes it very difficult to look like you know what you're doing in those instances. Processing issues can look like confusion about how to do things, even if it's something that you were very familiar with before. But now you have that confusion because just the process is not automatic anymore. You have to stop and think about each step in there. So that process, you have to think. It takes more time. You can look confused about it. Sensitivity to light and noise. Very common with processing issues because there's so much that you have to process. You have to process all of these bright lights coming at you. You have to process all of these noises. And then you have to process what you're actually trying to think and what you're trying to do. And that's too much. That's overstimulating for a brain. So having that sensitivity to light and noise can also be a symptom of processing difficulties. Irritability that's worse in busier situations. Again, the processing is more difficult in busy situations. It makes you more stressed, a little bit more tense. So you might get a little bit more irritable in those situations that are a little bit busier because your brain is trying to process everything that's going on. And then losing your train of thought. Because again, you were processing it and there's a bump in that process. So losing your train of thought. I did that for the first 6 months after my injury. How do you manage this? Again, taking frequent rest breaks, very, very good thing to do. Let your brain kind of calm down before you go on to the next thing. Limit your triggers when possible. If you know what your triggers are for making it difficult for you to process, try to avoid them as much as possible. We're not going to be able to avoid everything, and we don't want to avoid everything forever because we don't want to turn into hermits after a brain injury. But trying to limit those triggers while your brain is doing the big active part of healing is really important. Reduce screen time. This is one thing that we have said for the longest time with concussion is reducing that screen time, which is really difficult now because everything is on screens. So when we talk about adolescents, kids getting concussions, my children, the school district that they're in, everything is on iPad. So everything is screen-based. So I have with some of my college student patients, I have written for them to get things on paper so that they're not spending so much time on a screen. We do need to have that accommodation for people to help them be successful after a brain injury, because those screens can be very, very, all the flickering lights, the blue lights, everything on it can be very stress-inducing, headache-inducing, symptom-inducing. So reduce that screen time. Cut back on activities when your symptoms are worsened. I used to get migraines all the time before my head injury, and I couldn't exercise with a migraine. That kind of goes without saying on that. If you're having a lot of pain already and you're trying to stress your brain, it's not going to be good. So that same thought process is very important when you're trying to heal from a brain injury. If you're feeling like your symptoms are worsened, don't try to process more information. You need to take a break on that one. Work with speech therapy again. We just talked about that. The last P letter, definitely working with speech therapy. And lifestyle management, this really goes for any of the symptoms. And I should have included that this whole way through, but I really haven't. But lifestyle management, making sure that you get a balanced diet, as healthy as you possibly can. Healthy is a relative term these days, but as healthy as you possibly can. Staying well hydrated. We've talked about hydration on the show. Half your body weight in ounces of water, non-caffeinated beverages, things that are not going to be full of sugar as well. Those count. And then avoiding inflammatory foods. You might say, what are inflammatory foods, Mandi? It is prepackaged foods, truly. Anything that has to last on a shelf before you buy it is going to cause some inflammation in your body. Years and years ago, I learned about the paleo diet, and that's how I found out that I had celiac, honestly, is because I went away from all the processed foods. I went away from all the grains, all the things that were causing inflammation, because the choices that I was making were not beneficial for me. Paleo diet, you eat a lot of whole, real foods. Whole30, similar things like that, all have whole, real foods. So you're eating mostly vegetables, some fruits. Again, you need to limit your fruits if you're diabetic or if you're borderline diabetic. Healthy grains, if you can tolerate them. Vegetable grains, whole wheat grains, as long as you can tolerate them. If you have celiac, you can't do the whole wheat grains because that's part of that thing right there. And then the healthy meats, the healthy fats are also very important in your diet. So you don't have to cut all the fat off your steak if you're eating a grass-fed steak. It's eating what it's supposed to eat, so therefore you are okay to eat those fats as well. Omega-3s are really important. The vegetable oils, the canola oils that some people still use for cooking are high in omega-6s. Omega-6s increase inflammation. If you're using things like avocado oil, coconut oil, real grass-fed butter, those are high in omega-3s. It's going to decrease your cholesterol levels, your inflammatory levels, because cholesterol is a measure of inflammation, honestly. So if you decrease those inflammatory foods, you're going to decrease those blood levels too. So got off on another little tangent there, but all of those things are really important for the brain that's trying to heal. So I really should have included those with all of these things. But if you decrease the inflammation causing foods in your diet, you will notice right away pretty quickly that your processing does get a little bit better. Diet does play a huge role in that. The next P I want to talk about is personality. This is one that I hear from many, many patients as a complaint. Personality changes often very, very common. Very common. The things that we see are people have a lot of mood swings, a lot of irritability, trouble controlling their emotions, or frustration tolerance. That's a real thing. Quick to anger, increased sensitivity, impulsivity, social withdrawal. And then the big one is just not feeling like yourself. So all of these personality changes can be seen after a brain injury and can be due to multiple things. So it can be due to damage to certain areas of the brain. Again, that frontal lobe is a lot where our personality is. So frontal lobe changes in neurotransmitters and hormones in the brain. So it can be on a structural level, it can be on a hormonal level, many different reasons why we can see personality changes. And if you have multiples of those, definitely expect to see some personality changes, at least temporarily. How do we manage it? Again, lifestyle. Make sure you're sleeping enough. Make sure your diet is as good as it can be. Stress reduction. Stress never is going to go away, but learning how to manage that stress might be a better way to say that. Take breaks, avoid the triggers when possible. If you find those triggers, things that set you off, try to avoid those triggers. And then the big thing for this, again, is seeking professional help, because there's not a medication, there's not a quick fix that's going to take away your irritability. Some of the supplements that I tend to recommend will decrease it a little bit, but it doesn't completely take it away. So mental health therapy is incredibly important. There really isn't a whole lot else that's really been proven beneficial for this. So for the individual themselves, need to identify the triggers, need to try to identify the signs of frustration in yourself, learn new ways to cope with things. And couples therapy and family therapy is also important because, as I tell my patients all the time, it's not just the individual that had the injury that is affected. It affects your whole family. It affects your romantic partnership. It affects your relationship with your children, with your parents. So family therapy can be very helpful in all of that as well, and helping the family learn to deal with some of these individuals' new personality changes, but also helping the individual learn how to manage some of those changes themselves. I had to do some of that also, working with therapy to try to figure out what my triggers were and how to cope with anger better, because my irritability, my fuse is a lot shorter than it used to be. I will admit that, but I have done a lot of work to try to improve that and try to keep it in check and keep myself in check when I am getting frustrated. Learning that it's okay to say, you know what, I'm really frustrated right now. I need to take a minute and step away. So step away before you say something that you might regret. It's very, very important. Next, P letter, post-concussion syndrome. This one it's everything. It's everything that I talk about. Post-concussion syndrome is everything that goes on. So post-concussion syndrome, also known as persistent post-concussive symptoms, PPCS. Yeah, all of those things. Many providers still don't truly understand that this exists, and it definitely does. So years ago, we thought that most people got better within 3 to 4 weeks, 21 to 28 days. That was kind of the golden time frame. Beyond that, we really didn't think that there was much there. Maybe a few small percentage of people would still continue to have things, but it wasn't really thought of as something that was there. But it is. It's very real, it's a huge problem for patients. Last year in 2025, there was research that came out that identified that up to 50% of patients continue to have post-concussive symptoms up to a year after their injury, and about a third continue to have symptoms well beyond a year. So this is no longer the thing where we say that most patients get better within that 3 to 4 week time frame, because half of them don't. That's not most. So that does not mean most to me, at least. So the symptoms that persist for weeks or months after a concussion, that's what we're talking about as post-concussion syndrome or persistent post-concussive symptoms. It often includes cognitive changes such as memory and mood swings, balance problems, sensitivity to light and noise, headaches, vision issues. Any of those things fall into the category of post-concussion syndrome. And that's the biggest diagnosis that I put on charts when I see patients. It is typically diagnosed when symptoms have lasted for greater than 3 months. That's typically kind of the cutoff for that diagnosis. It can be very frustrating for the individual and their family because you don't understand why these symptoms just keep going on and on and on. And it makes a very significant impact on their ability to get back to work. They're dealing with their family, needing potentially to go to some family therapy. TBI itself, the whole category of traumatic brain injury, is considered a leading cause of death and disability under age 45 when you're in your prime working years. So when you're having this post-concussion syndrome, that's one of those reasons for disability, especially in these patients under 45 years old. It affects everybody, but that's the big thing when we're looking at these age categories, when we're looking at people who are in the prime of their life, their main working years, and now they can't because they have these symptoms that limit their activity. How do we manage these? The biggest thing with this is that it's an interdisciplinary approach. There is no one provider that's going to fix all of the problems with somebody that has post-concussion syndrome. I have a whole network that I have put together. I presented that for a support group recently to go through all of the different symptoms that can be seen, the different providers that are necessary. It's not a one-size-fits-all. It's not you go to this person and they're going to fix all of your problems. You might need to do multiple different therapies, working on different things, and they're going to work together harmoniously to help get you better. For me, it was not just my neurologist. It was my neurologist. It was my neuro-optometrist, my OT, my PT, my speech therapist, my neuropsychologist that did my testing, my audiologist that helped me with my hearing, my chiropractor initially that helped me with a couple adjustments to kind of decrease some of the pain initially and with some of the heat, and the neurological chiropractor, I can't remember if I said that one already, my neurofeedback technician, all of these different things. All of the different things that I had to do. It took all of that to make me better. There was not a one single thing that I did that got me better. It took all of that, plus all of the supplements that I did along the way, the red light therapy, everybody that played a role in my improvements. It took all of that to get me back to where I am now. So when I talk to my patients, it's going to take a huge team. We're going to make sure that we have the right people on the team, the right players on the team, but it's going to take a team to get you better, because it's not, like I said, it's not a one thing and done type of thing. We continue therapies, or we start new therapies. If you've been doing therapies for a while in one area and you don't feel like you're making a lot of progress, we can switch and go to somebody else. Different therapists have different tips and tricks that they've learned along the way. It might need to change to a new location that's, as I mentioned earlier, that's more TBI focused if they're not already there. This is when a lot of patients will start to consider those outside the box treatments like I did. And we have conversations on what they can budget, which one of these things, if they can only do one, which one will get the most bang for their buck, whether it's doing the red light therapy, whether it's doing the neurofeedback, hyperbaric treatment, the working with the neurological chiropractor. If we can only do one of those things because of their budget, we try to figure out which one is going to make the biggest bang for their buck right now. Later on, they can potentially try something different. But we have that conversation as well. Plateaus, everybody's going to hit a plateau at some point. And many times, erroneously, people are told that when they're at a plateau, this is as good as you're going to get. And that's not the case pretty much ever. So the good and bad is that there's no endpoint in getting better from a traumatic brain injury. It all depends on what you're doing. And that plateau gives us an opportunity to switch gears and try something different. It's not that's not where you are. That's not your end zone. That's not where you permanently are going to be. We just need to switch things up. And people love when I say that, but I say it from experience because I'm almost 3 years out and I'm still getting better at certain things. So it's still getting better. I'm still doing new things. Yes, that's all I can just say on that one. Will some things become permanent? Possibly. Yep. And then you have to adapt to them. My irritability, it's there. I don't think that's ever going to go away at this point, but learning how to adapt to it was really important. And I still have difficulties with exercise intolerance because my autonomic nervous system took a big hit with my injury. So I still have issues with that. I'm trying to recover from it, but I don't know that I'll ever be back to where I was with that. And in some ways, it's okay. It's going to take some work to really, really accept all of that. But some things do become permanent, and then you have to learn to adapt and accept those things. Because if you don't accept it, it's going to just keep eating away at you. Your brain heals in two different ways. It either heals by the damaged cells waking up and taking on their job again, or learning by compensation to learn to do things differently. And as time goes by, you do lean more towards that compensation side of things. But again, that's okay. You're learning to do those things that were effective before in a different way and trying to find something that's going to be just as effective, but doing it differently. That's okay too. Okay. The next one is POTS. And I put a lot of stuff on this talk. This is definitely going to be longer than half an hour because we're already more than that in. So I apologize for those that liked the shorter episodes. This one's going to be a little bit longer one because I still have several topics to cover. POTS on this one. POTS is postural orthostatic tachycardia syndrome. It is one of the 15 known types of autonomic dysfunction. And we know that it occurs in about 7% of all patients that have a brain injury. So that's a pretty small percentage, right? Though autonomic dysfunction is generally has been suggested to be much higher percentages. There was a study done at one of the Mayo locations that found 100% of the patients that were in that study all had autonomic dysfunction to some degree. So we've got anywhere up from that 7% up to 100% of patients that have some sort of autonomic dysfunction. And that is one thing that I see very, very often in my clinic. I experienced it in the grand majority of my patients. I wouldn't necessarily say 100% of my patients, but the grand majority of my patients do have some sort of autonomic dysfunction. There's a whole host of symptoms that can be included. They can include any of the ones that I'll list off here. High blood pressure, variable blood pressure, dropping blood pressure with position changes, such as when you go from laying to standing or sitting to standing, lightheadedness, especially when you stand up, palpitations or irregular heartbeats, irregular breathing patterns, intolerance to heat or cold, especially that heat changes in your patterns of sweating. So sometimes people won't sweat at all. Sometimes people sweat more in certain areas of their body. Constipation or diarrhea or going back and forth between the two. Nausea with or without vomiting, fatigue, sensitivity to light and sound, headaches, brain fog, etc., etc. There's a lot of other things that can go on with autonomic dysfunction. So the typical one that we're seeing is, when we're talking about POTS specifically, it's often characterized by that lightheadedness, especially when you're standing, and intolerance to hot showers. Most people that have POTS will tell you they cannot take hot showers. It makes them more dizzy and they want to fall over, and that's not a good thing. POTS is often connected with hypermobility, especially with Ehlers-Danlos syndrome, hypermobile type. So Ehlers-Danlos is a connective tissue disorder where people do have that hypermobility. It puts them at a higher risk of concussions, honestly. So having POTS, having EDS increases your risk of concussion and having a prolonged recovery from concussion. And then, as we just talked about, 7% of patients after a brain injury can end up with POTS, and potentially up to 100% that have some sort of autonomic dysfunction. So how do we diagnose it? There are a few different ways that we can try to diagnose this. It often starts with a sit-stand screening in the office, looking at your blood pressure, actually lying and standing. So lying down at least for 5 minutes, check a blood pressure, and then stand up. And at 1, 3, 5, 7 minutes, checking it again to see if that drop in blood pressure persists when you stand up. People can track their blood pressure. It's a really good way to kind of get a good information. The better diagnosis, maybe a more consistent one, depending on the reference you look at, would be more of a tilt table test, either with cardiology or neurology. It can also be identified through sweat testing. There are no specific blood markers that we know of, no imaging tests that we know of that can diagnose it, but a lot of it will be a clinical diagnosis as well. So there's an organization called the Dysautonomia Project. I had them on the show a couple months back as well. They have a patient screening tool that can be utilized as part of the diagnosis process. So that it goes through screening, and you answer first, have you been diagnosed with dysautonomia versus have you not been diagnosed? And then it asks the questions and gives you a score based on what the likelihood is that you have autonomic dysfunction. So I will include a link to this in the show notes this week as well, so you can find that pretty easily. How do you manage it? So once you find out you have autonomic nervous system dysfunction, again, autonomic nervous system is your fight or flight or rest and digest, the sympathetic and parasympathetic branches, and then the enteric branch, that's where we get the bowel issues as well. So that's our autonomic nervous system. But how do we manage it if it's not working appropriately? Probably the number one is hydration, drinking lots and lots of water, 2 to 3 liters a day, and increased salt intake. We can normally tell patients to just eat as much salt as they like on this. Sometimes just salty foods. Salt tabs can sometimes be used as well. Always being cautious if you have blood pressure issues. So this is not something you just do on your own. Do it with the management of a healthcare provider. Compression garments, such as either compression stockings, abdominal binders, or shapewear. Even a wrist compression device can be helpful as well. There are peripheral nerve stimulators such as the Apollo Neuro, the Dolphin, or vagus nerve stimulators such as Pulsetto. All or any of those could be beneficial for calming down the nervous system as well. Sipping on pomegranate juice. This is one that I got from my neurological chiropractor, Dr. Brandon Allen, that was been on here a couple times with me. Pomegranate juice, when I looked up the research on it, pomegranate juice has a lot of antioxidants, and it also has some good effects on when you have that blood pressure that goes variable. So sipping that pomegranate juice throughout the day can help to regulate the blood pressure so you don't have those big changes in the blood pressure when you have position changes. But really the number one thing that you can do is the hydration, because as I just did a training last week on autonomic dysfunction, and when you look at visuals to see if somebody's really well hydrated and they go from laying down to standing up, their blood pressure is not likely to drop, as well as if they're dehydrated and they go from laying down to standing up, then you're going to see the symptoms kick in because you don't have enough fluid in your system to maintain that homeostasis. The other things you can do, making sounds that include vibrations, because the vagus nerve goes through the throat and things like that too. So humming, gargling, kind of activates the vagus nerve a little bit for that part of the autonomic dysfunction. Diaphragmatic breathing, again, that nerve goes all the way through our diaphragm. So when we do that diaphragmatic breathing, that helps to calm things down. Cold water treatments, cold showers, whole body cold plunges, ice baths. The mammalian dive reflex, or submerging your face into a bucket of cold ice water, also can help to regulate the autonomic nervous system. Regular exercise, it doesn't have to be like big old HIIT exercise workouts or whatever, but regular exercise. And then realizing that this also is an interdisciplinary need for it, because there's not one body system that is alone affected by the autonomic nervous system. It affects every system in your body. So cardiology, pulmonology, neurology, even dentistry has to be careful, because Doing dental work can tend to trigger some people's autonomic nervous system, GI, because of all the issues with motility and things like that. So again, and optometry, because there are a lot of visual changes that go along with it. So there's so many people involved, and this is going to take a team approach to take care of somebody that has autonomic dysfunction, independent of whether or not they have a brain injury, but it can happen much more commonly after brain injury as well. The next P, so we're getting down to the last couple here, is pacing yourself. And this is going to be, again, for the individual with the brain injury. As we've discussed with many of these topics, it's important to take breaks before you need them, breaking down the activities rather than trying to push through and do everything all at the same time. It's also really important on days when you don't feel as good, because recovery from a brain injury is not linear. There are going to be up and down days. And on those down days, you really have to make sure that you pace yourself even more so than on those days when you feel good. But even on those days where you feel good, you got to be careful not to overdo it, because then you'll have a rough day the next day as well. Make lists, set priorities with a small handful of things. Don't write yourself out a gigantic to-do list that you're not going to be able to take care of, and then you're going to feel bad because you didn't get all the things done on your list. Make sure that you have a couple of those things marked as those things that you have to do today, and the others can wait, and you'll get them done when you get them done. Or you can ask for help with them too. Listen to your body. And this is one thing that I see a lot when patients have a brain injury. They tend to be really good at listening to their body and not overdoing things anymore, whereas people that don't have that same brain injury might not be so good at listening to their body, and they keep pushing through. It's really hard to see somebody with a brain injury that just keeps trying to push through, because they're going to feel like crap, and then they're not going to want to push through. So they do learn to listen to their body, and they do learn to identify when something is not right. So that I will say, I will give all of my concussion patients props on that, because they do learn that part. Stop and rest when you're feeling fatigued or overly sensitive. Identify the triggers that lead to hitting your wall. We've talked about so many of those things so many times already. Just remember to take it easy and give yourself grace. Talk to yourself like you would a friend. We are so much nicer to our friends than we are ourselves when we're trying to heal from something. My last P word on this one is prevention. And this one's a really important one, because can we really truly prevent head injury? Probably not 100%. Probably not 100%. Helmets are incredibly important. We have talked about them in contact sports and different activities where you may fall. So football, hockey, bicycling, skateboarding, roller skating, skiing and snowboarding. We're in the middle of winter sports here in the Midwest. Rock climbing, motorcycling, and snowmobiling. I've had so many patients that have had brain injuries from snowmobiling, motorcycling, any of the above, and they didn't want to wear a helmet because they didn't like helmets. And does a helmet fully protect you? No. No helmet will ever fully protect you from a head injury, because the head injury comes from the movement of your brain inside of your skull. So when you have that momentum, that coup contra coup that we already talked about, your brain is sloshing around inside of your skull. No helmet is going to stop that completely. But helmets can help prevent it from being a severe injury, so keeping you from having a skull fracture, keeping you from having a head bleed. So that's what we're looking at that safety with. In cold climates where there's a lot of snow and ice, walk like a penguin. Keep your feet separated from each other. Keep your arms out just in case you need to try to cautiously guide yourself. Just watch out when things are slippery so you can decrease the risk of falls, because falls is the number one cause of concussions overall, even above all the sports. With that, we need to really make sure that we are cautious and try to prevent falls from happening. We see this most often in the very young, those little ones that are learning to walk, and the very old, because we've forgotten how to walk, essentially. We don't have that same response time. So the very young, the very old, that's where we see the most falls doing damage. And then other than being careful on slippery surfaces like we just talked about, it's important to be careful on stairs, because falls often happen on stairs. Patients lose their footing. They're trying to carry things when they're going up and down stairs, lose their footing, can't see where their feet are, and they fall while they're going up and down those stairs. And that's where we see a lot of head injuries as well. And I just was talking to somebody recently that said it seems like when they fall down the stairs that are not padded in their house. So they're falling on the basement stairs onto the concrete. It tends not to happen as much on the carpeted stairs going upstairs. And that's a funny little thing to note with that. But often it does happen. So be careful when you're going down those stairs, especially when they're not padded on that. When you're crossing streets or walking on sidewalks, I see this far too often. People are looking down at their phones, whether they're having conversations, they're texting, they're looking for something. You can't see things that are in your path. You can't see if you're going to step off a curb if you're looking at the screen on your phone. So staying off your phone when you're out walking around, which you should be aware of your surroundings anyway. So as we've kind of been teaching our teenagers in the house, you need to be aware of your surroundings. Don't be on your phone when you're walking around for multiple reasons, because you need to be aware of your surroundings in general, and because you need to be aware of your surroundings for if you fall off a curb or trip on something and fall and hit your head. Always be aware of your surroundings. Avoid taking unnecessary risks. So try to avoid doing things that require a helmet and trying to do them without a helmet, because that's an unnecessary risk. I know sometimes I'm talking to people who are just not going to listen to that, but I'm going to tell them anyway. So wearing a helmet is always your best defense. Is it going to prevent you from having 100% of concussions? No. But will it prevent it from being a severe one? Possibly. Yep. Don't text and drive. If you are talking with a passenger in your car, you don't have to make eye contact with them. I watched this at a stoplight the other day. The driver of the car was literally just looking over at their passenger having a conversation. They missed the light turning, and as they're going down the entrance ramp to get on the freeway, they're still looking at the other person, kind of swerving back and forth. So dangerous. You don't have to make eye contact with your passengers. Just have a conversation while you're looking forward and watching the road. And don't text and drive. There are so many things now. I was not on my phone. My husband was not on his phone. We were in our car accident, but still I have turned my phone to go into CarPlay mode. So when I get in the car, I plug it in, it goes to CarPlay mode. The only things that come through are text messages or phone calls from my immediate people that I mark as my favorites. So I only get text messages and phone calls that come through that, and it comes through the speakers of my car. So it reads the text messages out loud, and the phone calls will come through there. It is all hands-free, so I'm not looking at screens. I'm not doing any of that. And that's the safest way to do that, but still you need to make sure that you're staying aware of your surroundings. The best concussion to recover from is the one that didn't happen. So the most that you can do to try to reduce your risk, to reduce the chance of having a concussion, those things will save your brain in the long run. And if you haven't had a concussion, you don't want to have one. And if you've had concussions, you don't want to have any more because of the risk of permanent damage when we have multiple concussions. So many good little nuggets in this show today. If you've made it this far, thank you so much for being here. Lots of information, lots of great information. Perhaps you broke it up into 2 times listening, and that's okay too, because I just want you to get the information. So lots of really good stuff today. If you have requests for other topics for the remainder of the alphabet, let me know. Otherwise, I'll be back next week with a new interview for the show. And again, if you have more topic ideas, things you want me to cover on the show, please send me a message, comment. And I would love, love, love to try to make this another banner year on the podcast, because last year I got some awards for it being the one of the fastest growing podcasts. I'd love to do that again this year. That happens by you liking, following, subscribing to the show. I think that's on YouTube. The other ones don't call it subscribing, but following, sharing it with others, commenting on it, because that interaction gets it bumped up on the playlist as well. So let's try to see how many more people we can get educated about head injury this year in 2026. Thank you so much for being here with me today. Have a great rest of your day. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, leave a comment, and share it so that others can benefit. Please also consider supporting the show by buying me a coffee. The link is in the show notes. You can also go to www.brainwellnesssolutions.com to catch the latest info and get links on all of the social medias there. See you next time.